Hi, I'm Pat, and I'm from Palos Hills, Illinois. I'm 77 years old, and I come all the way out here just to see Dr. Hunnuis because he was the doctor that helped me when I needed it most. I had fallen and injured my knees, my shoulders, my neck, blah, blah, blah. But other things I had needed to be taken care of first, but I kept knowing that my knee was bad. And I had an x-ray taken of my knee, nothing showed up. But my knee kept hurting. So my daughter met with Dr. Hunnuis a while back, and she said, "Ma, why don't you go see this doctor?" So I did. I came here, and it was the best thing I could have done. The first thing that he did was he did an ultrasound, and he found the torn meniscus, and where it couldn't be found before, but he did. And then he said, well, you know, there's a couple things we can do to help. And he gave me an injection the first time I was here because he then explained to me the difference between surgery or he explained the stem cell. I'd never heard about it before. And so I told him I wanted to go home and think about what I had. But I knew right from the start I did not want to go to a hospital. I did not want to have surgery. And I wanted to do something that was new and different, not only for myself, but just to see how it worked, and then I would do something else if it didn't. After he made his diagnosis, I went home and I talked to my daughter, but I already knew that I was going to go for the PRP. And so we made arrangements to do that. He explained what they were going to do, and he did a good job doing that. And personally, I was very impressed with the patience that he took with me to explain the difference between surgery and the PRP, and I decided that's what I was going to do. I do live alone. I have a dog, and I knew that I just couldn't go into a hospital, or I didn't want to do that. I was willing to try something new, and so that's what I did. It was a very short time between the time we discussed it and the time that he did the procedure. And I didn't know exactly what was going to happen, but when we went into the office, when he did the procedure, he explained everything he was doing as he was doing it. And so that, of course, made me more comfortable. And I was impressed when I saw the blood that they drew, and then it was, they took it and shook it and did whatever they had to do to it and brought it back in the little needle. I thought it was going to be this great big procedure thing that, and so it was very easy. It was very easy. And he took the needle and just went right into my knee, and of course he had his screens and whatever he uses, and it was done so fast that I couldn't believe it was done. And I don't know if it was his gentleness or just the fact that you're having that kind of a procedure that doesn't cause the pain and other things that happen when you have surgery. So I got up right away, and I had a brace, and we went up to the stairs there. I was able to walk out of the office, walk right up the stairs to the second landing, and walk down with very little pain. Prior to that injection, I couldn't walk a step up. I was hanging on to the sides of the walls to go up, down the stair, even walk through the house sometimes. And I was so happy. And it's not that the pain went away, all of it immediately, but every day it got better. When I walked outside, especially using the brace, when I walked outside, prior to that, I couldn't go down a curb without, I was calling myself Thumper because when I would go to step down a curb, I would be like this and hanging on, and it was awful. I just couldn't be on my own without that injection, and that really was just a fast. I mean, I could move, I could kick my knees. Before I couldn't kick my knees. I could cross my knees, I could cross my legs, I could walk my dog, and I still had some pain, but it went away very gradually without a lot of problem, and I'm just thrilled. I'm so happy I made that decision. I recommend it to anybody, to all my friends. Don't wind up having surgery if you don't have to. And of course, medication. I didn't have to go on all kinds of pain drugs, and very simple. If anything, I took Tylenol. I'm pleased. In 6 months, I have very little pain, if any, and I enjoy my walking with my dog. I enjoy going up and down the stairs, and I'm just happy with the whole thing. I'm happy with the way the doctor explained to me what my options were, and that I had a choice. The biggest thing was the choice. And I was willing to try something new without having to go through surgery. And there was a little cost. I was willing to pay that. But I'm happy I did it.
Patricia came to us and was having a lot of difficulty with her knee. It was to the point where it was keeping her from just going out for walks, which she was doing at the time. As things got progressively worse, she, in addition to that, had suffered a fall, which had exacerbated and made it really difficult for her to just walk. And besides just walking, was in chronic, constant pain, day in, day out. And I believe was causing her difficulty to sleep at night. So she came to us. On the initial evaluation, we took a look at her knee in conjunction with the ultrasound. On that ultrasound, it showed some evidence of medial collateral injury, as well as suspicion by the ultrasound that of meniscus tear as well. In that circumstance, I wanted further evaluation. And so we got the MRI. On there was some degenerative change, osteoarthritis, but in addition, the acute increase in pain that was really causing her a great deal of disability was the meniscus tear and the MCL, the medial collateral ligament sprain. So talked with her in terms of treatment options. And that included not only a regenerative medicine approach versus a surgical approach, but in addition, we set her up for a unmotor brace, which allows to provide some stability to that knee, as well as alleviate some of the load to that injured meniscus, which in many patients will provide a lot of instant pain relief, essentially, when they put that brace on. And she was able, we trialed that in the office, had her walk around, had her go up and down some steps, and she was one who had instant improvement from symptom standpoint. So that's a symptomatic improvement for her. That unfortunately isn't going to treat that underlying condition, which was the medial collateral sprain, the meniscus tear, in conjunction with some arthritic change. And from that standpoint, she decided that the regenerative medicine approach would be best for her. So we treated her with a stem cell injection to her knee, in conjunction with PRP, platelet rich plasma. So we had those two treatment modalities combined. And for treatment of all three of the conditions that she had, it's going to be beneficial for her arthritic knee as well as the meniscus damage and tear, and injected the MCL, the medial collateral ligament. But when we do these procedures, and in Patricia's case, of course, as well, we do this under ultrasound guidance so that we are certain and precise. We can visualize these structures and make sure that we're directly in the area that needs that specific treatment to maximize improvement and ensure good outcome. Over the course of time, has progressed to where she is very satisfied with the treatment outcome at this point in time. She's much more mobile at this point without that pain. I know she likes to visit many of her family members, and so she's very active and going. And for her to be able to do that in a fashion where she's not using an assistive device to walk or in constant pain or limping is really a big success for her. Especially in the face of not being able to, to be able to achieve those results in a non-surgical fashion.